Good morning and good afternoon. Bon matin et bon après-midi à tout le monde qui nous rejoint aujourd'hui. Juste pour vous inviter, nous avons de l'interprétation simultanée par écrit en français, en anglais. Donc, s'il vous plaît, suivez les étapes sur la page devant vous. Et si vous avez des questions, n'hésitez pas à les poser dans le chat pour l'instant. Welcome, everyone. We have English and French transcription available today. If you require it, please feel free to follow the steps on your page. The presentation will be in English today with French transcription. Thanks.
Thank you, Sarah. We are just getting some feedback that things are echoey for some folks. So I don't know if there's some technical adjustments that need to happen to address that. Okay, doesn't look like it's the case for everybody, so we'll proceed. I want to welcome everybody here today. My name is Marion Cooper, and I'm the Lead Executive Officer for the Canadian Mental Health Association, the national organization. And this webinar has been subscribed in a really significant way. We have over nearly 800 people who've registered today. And of course, hopefully it's a beautiful summer day wherever you are. And we know that some of those that registered may not join us, and hopefully it's because they're enjoying the summer. But we're so glad that you've all taken some time out of your day to be with us and to be a part of this important conversation. So before we move into our discussion and talking a little bit about this very important issue, I want to take a moment to start us off in a good way. And, you know, it's really in terms of pausing and taking a few moments as we all move forward with our commitment towards reconciliation. I want to take a moment to just share that CMHA acknowledges that we're deeply committed to this work. And today, just as a reminder, the Canadian Mental Health Association has offices in every province and the Yukon across what our Indigenous relatives call Turtle Island. I'm located in Winnipeg, which is Treaty 1 territory and the homeland of the Red River Métis. It's also the ancestral lands of the Anishinaabe, the Innuak, the Dakota Oye people. This territory is also the place of significance for the Dene and the Inuit people, some of whom have been living on this land for generations. Serving as stewards since time immemorial, elders and First Nations have highlighted these ancestral lands remain unceded and that the treaties are agreements to share, not surrender the land. Remembering the original spirit and the intent of these treaties can serve as a foundation to better all of our relationships. And I think that's an important point for today. As an organization, we endeavor to unlearn colonial mindsets and practices, to grow in knowledge, and to adapt ways of working. And as we continue to build meaningful relationships with one another, we recognize the historic and the ongoing contributions of Indigenous people and honor their leadership and partnership in shaping and strengthening communities across this country. And we're so thankful. So with that, I am going to open up our conversation, and the conversation frame is all about mental health and funding. And we can't really start that conversation without really grounding it in the stories of the lives of people across this country who have struggled with mental health issues, be it mental illness, mental health distress, substance use health issues, addictions. And we all know countless people who have experienced those challenges. We ourselves may have experienced these challenges. We have loved ones. And of course, if many of you are here as service providers, you know day in and day out the difference our community mental health services across this country are making to respond to the needs of individuals who need these services. I want to take a moment, though, to just invite all of us to think about a person and to really understand how critically important this conversation is today and ground that in that lived experience of a person who has needed services and was fortunate enough to get services, and some who are still waiting and have struggled to find those services in our communities. And so there are many stories, and I don't need, you don't need me to tell you. You already have somebody in mind right now. That person may have tried to get help. They may have waited. They may have struggled to find the care that they need. In fact, it might be you. It might be one of us. And so we know these are deeply personal realities. And this is not, a theoretical or an issue that hasn't touched all of us in such a deep way. So keep that in mind. But it also grounds why we do what we do and why this conversation is so important. Because it's with those stories and with those lived experiences that advocacy begins. And it fuels the reason why we do this work. And we continue to support these conversations and to ensure that those services continue to be available for people who need them in timely ways in our communities. So I want to just make sure that we take a moment to carry that story into all of our conversations today, and that advocacy is really at the heart of why we want to bring all of you together, and that the renewal of the federal mental health and addictions funding is really an important part of the kind of services that have been possible over the last number of years because of those investments. And we want to make sure that those investments continue so that we can continue to strengthen and ensure that that system is in place for people. And we know that the needs have grown. So with that, I'm going to pass it on to Sarah to share a little bit about what advocacy looks like and why we have to have this conversation today.
Thank you so much, Marion. My name is Sarah Kennel. I'm the Vice President of Policy Partnerships and Advancement here with the Canadian Mental Health Association National Office. And I'm joining you from the unceded, unsurrendered territory of the Ganegeha, home to the Algonquin, Ojibwe, Huron-Wendat, and Haudenosaunee, otherwise known as the Greater Montreal area. So thank you so much, Marion, for opening in that good way and for really grounding the conversation we want to have today in the powerful role that we all play in changing the systems that we exist within, whether we're delivering services and care, supporting a loved one, receiving care, in a position of decision-making, or even from the media. I understand we have some folks joining us from some outlets across the country. So with that, we just want to take a moment to situate who we are in the room today. So I'll invite folks to identify the option that works best for them. So or that describes you the best, whether you're an interested community partner, a partner organization, a government representative at a municipal, provincial, territorial, or federal level, frontline mental health and addictions or social services organization or other. So I'll leave that open for a second and invite folks to let us know where you're coming from today. Okay. And maybe I'll, with an interest on our time, move us along. Could I get a quick summary on responses to that poll? Amazing. Okay, so we're really split across the board with about 30% of us coming from a partner organization, 35% coming from frontline mental health, substance use health, social services, about 16% from community, great, and 6% from government. So that's excellent to see. Thank you so much. And I see some folks in the chat identifying themselves from the media as well. Thank you. So the next question we have for you folks is another grounding opportunities to just for us to help really level the playing field in terms of the level of knowledge that we're bringing into our space today. How familiar are you with how mental health and substance use health services are funded? So, part of the challenge and the dilemma before us is really being challenged to identify where funding is flowing from, recognizing that in the mental health and substance use health sector, it's often patched together, whether it's coming from government, philanthropy, corporate, even donations from Canadians. So if you could just take a minute to locate where you feel a level of comfort, whether it's very familiar, somewhat familiar, not very familiar at all, or not at all, not applicable to me. We'll just give folks a sec. Okay, I think we're ready to close that up if we could see the results. Okay, wonderful. So there's somewhat familiar being the driving decision here, with 46% of our respondents responding somewhat familiar, followed by not very familiar, 27%, very familiar with 22%. Awesome, some experts in the room. And then about 4% who are not familiar, not at all familiar. Excellent. Okay, great. Well, that's a really common representation of the Canadian public as well, in terms of knowing that there are services available, but perhaps experiencing frustration in accessing those services at times, and then not knowing what level of government is funding or where that funding is coming from. So the purpose of today's conversation is to really unpack how we got here, how the mental health system came to be. So by way of just perhaps putting it in the chat, and I'll also mention that we will have an opportunity for question and answer at the end of today's discussion. I will invite you to use the Q&A function in Zoom to put your questions there, and use the chat for other discussion. So just to, again, get a bit of a grounding, how many folks are familiar with the Canada Health Act or the Canada Health Transfer? These are two federal pieces of legislation and funding mechanism that really set the stage for the conversation that we're having today. And I'm just looking at responses here. Yep, very awesome. And so the other piece that we want to draw attention to today is not only those two core pieces, but also the 2017 Common Statement of Principles on Shared Health Priorities. So just by way of putting in the chat, how many folks knew about the 2017 Common Statement of Shared Health Priorities? Yes. No, not me. No, seeing a lot of no's. Okay, excellent. So welcome to a time for us to nerd out together on federal health policy and how it plays out in the mental health and substance use health system. So in terms of where we're at today, we know that research conducted by the Canadian Mental Health Association and many of our partners who are with us today show us that the mental health of Canadians is 3 times worse than before the COVID-19 pandemic. 2.5 million Canadians can't get the help that they need. That's more than the populations of Manitoba and Saskatchewan combined. Rates of suicide, particularly in the north, are high, and the toxic drug supply is claiming lives at an alarming rate. We also know we're operating in a very new context in the last couple of years. We see technological advancement occurring at a pace that is hard to keep up with, and creating new spaces to interact with one another. And that's often contributing to rising rates of loneliness and isolation, with young people turning to AI and chatbots for connection. We also are living through an affordability crisis unlike ever before. That's putting upward pressure on the access to services that I'll speak to a little bit later. And all that is having an impact on the mental health and substance use health system, and how it has shaped access to care in a system that really actually has probably never been a system at all, but rather a patchwork piecemeal series of programs and services that have emerged over the past couple of decades. CMHA's history helps us tell the story of how this system, or lack of a system, really came to be. So we were founded over 100 years ago. Our first name was the Canadian National Committee on Mental Hygiene. And one of the first initiatives that we undertook as an organization was to expose the conditions in asylums that at the time were deplorable. People were warehoused in poor conditions and removed from their communities, from their families, from everyday life. And we undertook a research project back in the 1950s that helped expose those conditions and call for their closure, recognizing that we could do better when we delivered care in community with wraparound supports that helped prevent the worsening of symptoms and helped folks recover in community. So in 1963, CMHA published More for the Mind. It was the foundational document that really painted the picture of a vision for community mental health in Canada, and it led to the production of the framework for support years later. And it really helped situate conversations at the time that were playing out in relation to the emergence of Canada's public universal healthcare system. So as the community mental health sector was in its infancy, as we emerged out of a desire to create better access to care, recognizing that new innovations and improvements were being made on the pharmacological side and the clinical side of things, the emerging conversation at the national level was really about what does our health system look like? What should it look like? So at the time, leaders such as Tommy Douglas were really engaging in national discussions around the future of public health in Canada. And that vision for public universal healthcare really aligns to what community mental health and substance use health is at its core. It's rooted in prevention. It's rooted in early intervention. It's rooted in support for the community. And we know that many of you from coast to coast to coast joining us today share in that vision. We know that, and research has demonstrated this time and time again, that when we take that holistic, integrated, comprehensive approach that includes not only clinical care, hospital-based care, doctor-provided care, but community services as well, that we see lives saved, we see better outcomes, and we see reductions in healthcare costs. So these conversations at the national level were playing out, and they really centered on that move to deinstitutionalize. So close the asylums, transition care out of mental health hospitals or mental hospitals as they were called at the time, and shift investment away from those locations into community. And as that was playing out, we see the emergence of what a publicly funded healthcare system could look like. So the provinces and territories engaged in negotiation with the federal government at the time, with that promise to transfer funding from the federal government into communities. So relocate the funding that had been allocated towards institutions or asylums at the time into community. And unfortunately, that investment never came, and it left municipalities holding the bag and individuals who had been institutionalized at the time discharged from institutions with nowhere to go. They were left with a welfare check and a prescription and left to community to municipalities to deal with. It almost sounds familiar to some of the situations that we're dealing with today in communities. So let's look at an example of what that looked like in one city in Canada. So this is the Parkdale neighborhood in Toronto. This is the West End. Our pictures are from the West End of Toronto in the 1970s. So as I mentioned, asylums were turned into mental health hospitals and downsized, and folks were discharged into community. They weren't transitioned, they weren't supported, but they were discharged. And in the absence of investment into community infrastructure, there were limited options for people to get the support that they needed. Many ended up in rooming houses that were overcrowded, poorly maintained, privately owned, and largely unregulated. Others cycled through the emergency department, shelters, hospitals, the justice system. And at the time, this was a new phenomenon. And emerging conversation arose regarding coroner's inquests, because obviously folks at the time who had been discharged from those hospitals or institutions lacking the care that they needed were dying in the streets. And so coroner's inquests were examining those deaths, and it was found that the lack of transfer of funds from institutions into community was the source of the problem. But these weren't isolated failures, they were predictable outcomes. And that's where we see the emergence of community mental health. Community stepped in at the time. In the context of the Parkdale community, we saw the emergence of incredible organizations that continue to deliver care today, like the Parkdale Activity Recreation Center, Parkdale Legal Services, Parkdale Queen West Community Health Center, Loft Community Services, and if you're on the call, big shout out to the incredible work that you do in communities every day. They filled a vacuum where institutions backed out and where government really dropped the ball in terms of ensuring adequate investment was made. And so these organizations, and they continue to do so today, are patching a system that was never meant to exist. And we see that play out in today's shelter system with the housing crisis and homelessness crisis that we see in encampments, in emergency departments, in pressures on the acute care system, in police stepping in to intervene in crisis that they were never trained to do. And this is all made worse by the current context where we have pressures on affordability and housing insecurity that are making access to care so much more difficult. So as this was playing out in the 1970s and the lead up to the 80s, we see the enshrining of public universal healthcare system, healthcare in the federal legislative context. So 42 years ago, we see the adoption of the Canada Health Act and the accompanying Canada Health Transfer, which funds provinces and territories with federal dollars to deliver medically essential care that is earmarked or restricted to the care that's delivered in hospitals and by physicians. So that means that family doctors are, of course, an incredible place to start and often the entry point into the mental health and substance use health system for many Canadians because it's paid for through our provincial and territorial health insurance plans. Yet we know that 6 million people in Canada don't have regular access to a family physician, and the wait times to get into some of those appointments can be really long. This represents about 15% of the overall population. We also know that through the enactment of the Canada Health Act and the accompanying health transfer, in its limitations around where services are delivered and by who, many mental health and substance use health services were left out, meaning that services like counseling and psychotherapy, eating disorder treatments, addiction care, a lot of these services fell outside of what is delivered by provinces and territories through their provincial health insurance plans. And that means that many people have to pay out of pocket, especially when they don't have access to private employer-paid insurance plans. We know that there are about 8 million people across the country who don't have access to that private health insurance. And in the age of, again, an affordability crisis, access to care becomes that much more difficult. Recent research showed us that 50% of young people between the ages of 18 and 24 who are already showing signs of a mental illness were not able to get the care that they need on account of cost. So that's leaving a lot of folks to have to make impossible decisions around paying for their life-saving counseling or psychotherapy and putting food on the table, getting addictions treatment support, or paying rent. These are options and choices that no one should have to make within Canada's supposedly public universal healthcare system. And it also means that in the absence of a real nationwide or pan-Canadian approach to an integrated and holistic system that includes both physical and mental health, that decisions around what to fund and how to fund are left to the provinces and territories when it comes to mental health and substance use health, meaning that we have 13 different mental health and addiction services at play in reality. So when we think about the opportunity before us as advocates, particularly those of us working at the national level, it's really hard to then think about how is this going to work at a national level. So Marion, over to you in terms of how community has stepped in response to the challenges associated with delivering what is really complex and also fragmented in many ways.
I think, Sarah, you've shared so much of that history that I think really helps all of us to understand, how we've gotten to where we are. I also want to acknowledge the kind of innovation and really amazing work that happens in communities across the country within the community mental health sector, where you have really strong programs and supports in place, whether that's housing first or assertive community treatment teams or rehab and psychosocial supports, and then a whole array of things that have really made a big difference in communities. And I really want to acknowledge all of the community organizations that are around this webinar today, and in particular, the Canadian Mental Health Association, which has grown across the country and is delivering services and programs in communities throughout Canada. So there's lots of really positive things and a real strength of a service array that's really responding to those needs. But we know that unfortunately it hasn't been enough. And one of the opportunities that many of us talk about is the importance of shifting from an illness system to a well-being focused ecosystem where we're prioritizing prevention, early intervention, mental health promotion, and that this should be fundamental to creating that ecosystem where we're actually seeing people access supports before things get too difficult that they may need, hospital or other intensive wraparound services. The evidence is really strong for this kind of approach, and we've seen many, many examples of really strong innovative early intervention, prevention, and promotion initiatives across the country. But we still see them as opportunities that sometimes come and go because of pilot projects or demonstration projects. But continuing to build out a system that really is embedding prevention and promotion and early intervention throughout the whole continuum. That we actually see these things being normalized and not special, that they're actually available across Canada. The other thing that's really important is for us to think about how crisis response is part of our system. And, how do we get it so that it's no longer the front door, the first place that people access service? How do we create more front doors for supports in ways that are timely and responsive and, again, reach people before things are at that point of crisis? The other thing that we know is really critical, and we started our day together acknowledging Indigenous homelands and the importance of reconciliation. So a part of the solution really is also around cultural reclamation and restoring balance, and having Indigenous and wise practices really also support the development of a mental health system at a community level that really considers culture at the heart of it. So those are real important considerations when we think about the opportunity to keep a strong voice around developing and co-designing a mental health care system that works for everybody. And it's focused on funding, it's focusing on policy, but it's also focusing on really creating that broader approach to promoting well-being and protecting well-being as part of an important priority going forward for Canadians. The other thing that I just want to take a moment to share a little bit about is, the role of community mental health. And we know that really community is where health intersects. It's where education, housing, employment, and justice all come together. And so often when we think about the community mental health care system, and we think about the ways in which we want everyone to be promoting mental health, it's not just those that are delivering mental health services. These are folks that are teachers, it's those coaches, and it's our community, the social capital, our friends, our social networks that are an important part of strengthening that social well-being and the ways in which we all support each other and we create caring networks and caring communities to be there to respond and to look out for each other. And some of that, of course, has been really strengthened by our attempts to increase mental health literacy through education and training, which also is another important aspect of a community mental health response. It's building that mental health literacy and really strengthening everybody's part in that work. So in terms of our important reframe here, mental health isn't just owned by the healthcare system or the health sector. It really is co-produced across sectors and systems and settings. And that certainly a part of the role of a community mental health response system is to really look at the whole that's part of the larger context. And that's really complex sometimes, requires collaboration, requires funding, and requires real partnerships to implement and support sustainability. Over to you, Sarah.
Thanks, Marianne. And that's where exactly we've, 40 odd years into the implementation of the Canada Health Act, the federal government in particular started to recognize that innovation and that new way of thinking beyond the four walls of a hospital, beyond what is delivered clinically by doctors, and how can we complement those interventions with community-led care. And in 2017, the federal government at the time really wanted to start filling that gap. And so it identified or entered into negotiation with the provinces and territories at the time that were really strongly advocating for an increase to the Canada Health Transfer, recognizing ongoing pressures to acute care and family doctor shortages, surgical backlogs, the rising cost to deliver healthcare, all of these important considerations. And so the feds and the provinces and territories ended up agreeing to a set of bilateral agreements that would come into effect in 2017 with a 10-year funding horizon, costed at $11 billion. And the two priorities identified were mental health and addictions and home and community care. And the idea was to really start filling the gaps created through the enshrining of the Canada Health Act 40 years ago, with a view to really look at the programs and services and health and beyond offerings that had been neglected, had really been left out of the conversation during that negotiation. And so what did those bilateral health agreements fund? These are the 2017 bilateral health agreements that I referred to at the outset of the presentation that were articulated in that common statement of principles on the shared health priorities. So within the mental health and substance use health bucket of funding, $5 billion was allocated from 2017 until March 31st, 2027 for priority programs and services in the areas of community-based mental health and addiction services for children and youth, structured psychotherapy and counseling support programs, addiction services, early intervention programs, and services for priority populations. And we know that many of you are the recipients of projects funded through these bilateral health agreements, including many CMHAs across the country and other parts of the health system. And it has led to more access to counseling, expanded crisis services, outreach for people experiencing homelessness, stronger community programs. Many communities from coast to coast to coast have benefited from this investment that has been flowing for the past 10 years. So when we look at it year over year, dating back to 2023, when we started tracking this investment more specifically, we see that there's an annual year over year investment of $600 million going to provincial and territorial governments. And then the provinces and territories enter into conversation with community partners, health authorities, et cetera, to identify programs and services within those priority areas to expand access to care. So the impact of this funding has really been significant over the past 10 years. And here we look at how much each province and territory is receiving total. I was just in Charlottetown, PEI for the Council of the Federation meeting. Shout out to folks from PEI on the line today. So folks in PEI have received almost $8 million since 2023. And that's just the last couple of years. And those programs on PEI have funded school-based interventions, hiring of nurses to deliver mental health promotion, mental illness prevention initiatives, and also to establish a province-wide mobile crisis response program that is operational to this day. So many of you will recognize perhaps some of these investments and the significance of them. So back in 2023, the federal government, again, entering into conversation with the provinces and territories. We're more than halfway through the 2017 agreements. Again, re-engage provinces and territories to look at how they can, again, invest in areas of critical importance, of shared importance with the provinces and territories to continue filling the gap in access to healthcare. At this point, we're in the post-pandemic period, and we're experiencing unique challenges within the health sector, health system, that needed to be addressed in order for us to get back on track and really ensure that people across the country were getting the care that they needed when they needed it. So at the time, the federal government entered back into negotiation with the provinces and territories to develop a new series of bilateral agreements, again with a 10-year horizon, this time at $25 billion in 4 priority areas, with mental health and substance use health and addiction services being one of 4 priorities. So that meant that there's a new investment year over year, beginning in 2023, for mental health and addictions care of $301 million, on top of the funding that was already going towards mental health and addiction through the 2017 bilateral agreements. When we looked at the amount that's actually going into mental health and substance use health across the 13 agreements, so you have to look under and deep buried in the appendices of each of those bilaterally negotiated deals with the provinces and territories, you can start to see how much is actually going to what across those 4 areas. Our analysis is that 15% of these working together agreements is going towards mental health, and that being the average, recognizing that some provinces put allocated a lot more percentage-wise into mental health and addiction than others, with the median being closer to 5.7%. So we see some provinces or territory like Yukon allocated 65% of its 2023 funding towards mental health and addiction, but then others barely allocating any. So when you look at them together, we see in this fiscal year, $600 million finishing up the 2017 agreements, ending in March 31st, 2027. So that's $600 million flowing this year, as well as $301 million through the 2023 agreements, meaning that this year, provinces and territories are receiving $901 million. Come April 1st, we see that those 10-year agreements, the 2017 agreements, are sunsetting, which means that we will see a decrease in funding available to provinces and territories, a reduction of $600 million a year. So we at the Canadian Mental Health Association for the past couple of months have started to meet with federal, provincial, and territorial officials to ensure that they are aware and to start advocating for a renewal of this critical funding, because we know that it has had immense impact in community for the past decade. We've developed some messages that we think are important given the moment in time that we're in to really ensure that folks are situating the conversation in the mood of the country. So that the first message that we've developed to build support for this important renewed investment is that we just can't afford to go without mental health. As we talked about already, in the context of an affordability crisis, when many are already having to make difficult decisions regarding what they can afford and not, and job losses that create or lead to increases in stress and anxiety, we know that that pulling back on or reducing access to care will have a negative impact on our overall health. And we know that Canadians are deeply supportive of investment, particularly federal investment in mental health and substance use healthcare. Public opinion research that we conducted in the last couple of months demonstrated that 81% of us support maintaining mental health services through continued funding from the federal government. We also know that our economy is strongest when Canadians are mentally well, that investments in mental health is economic infrastructure. We know that mental health disorders are a top 5 cause of disability in Canada, and that costs us $180 billion a year. This is new research from the Canadian Standards Association. And that 500,000 Canadians miss work every week for mental health and addiction issues. So this is having a huge impact on our productivity and our economic resiliency. We also know that failure to renew, so if we don't get this renewed investment, that it will have an impact on our health and social systems. We know that when folks have nowhere to go, they turn to shelters, police, hospital, often the emergency department, and we know that the pressures on those systems are already incredibly high. So we don't want to add more pressure to those systems when we do have options on the table through the continued investment in from the federal government that would ensure these services remain accessible, to keep wait lists down, and to reduce pressure on these other services. So what can we do about it? Together, we invite you to be part of a movement that is growing from coast to coast to coast, that is calling for a renewed federal investment in this budget. We've already seen incredible sign from the provinces. We were just at the Council of the Federation this past week. Premiers released a communique, which is an incredible feat in and of itself when you think of the consensus building that needs to happen across 13 very different jurisdictions. They came out in support of this, a renewal of this funding. They explicitly said, we want the federal government to continue investing in mental health and substance use healthcare through a renewal of these 2017 bilateral health agreements. So now's the time for us to be mobilizing support, to support one another, to really call on the federal government to ensure that commitment translates into an investment, a budget line in budget 2026, the federal budget 2026. We know we've worked on this together for decades. This didn't start in 2017. Many of you have been advocates for decades. We have won these fights before. We have secured significant investment in our system before, and we can do it again. We expose the deplorable conditions in asylums. We've come up with better ways of delivering care. We've innovated. We've reached different populations, new populations, hard to reach populations. We've imagined what community-led mental health and substance use healthcare can be. And now's the time to see it come to fruition. So what are some things that we can do together? First of all, you can sign up to join this conversation at actformentalhealth.ca. It's a campaign led by the Canadian Mental Health Association, where you can learn more about what we're up to and how we can work together in service of Canadians' mental health from coast to coast to coast. You can talk to your community and you can ask them to sign up too. The more of us that are singing from the same song sheet, the better. You can write to the Federal Minister of Finance. He's the one who's putting pen to paper on the budget and needs to hear from us. So there's a letter template at the actformentalhealth.ca website. All you have to do is put in your email address and your name and click send, and maybe even a postal code that helps us know where you're coming from. I may have got that wrong, so apologies, colleagues. But it's a really easy step you can take to let the federal government know that you're concerned about this potential expiry and that you want to see a reinvestment. We also invite you to check out your local Member of Parliament's summer barbecue or whatever else they have on the go this summer. Often federal MPs are back in the riding, meeting with constituents. There are many opportunities that you can look for to meet them. They're often visiting different organizations, having community town halls, youth groups, etc. So if you're out and about in your community, feel free to knock on your MP's door, find out what they're up to this summer, and talk to them about this. We have lots of resources on the Act for Mental Health website that you can check out that can help you have a conversation with your local Member of Parliament about this. The more they hear from us, the better. So with that, I'm going to launch into our last question, which is, what is something that you're taking away as a learning or action from today's webinar? Today, we talked about how the system came to be, how new funding emerged and why it's so important for it to continue. So we invite you to take a moment, and in the chat, there's no poll. Just if you could share a reflection on something that you're walking away with today, we'd really like to hear that so that we can inform where we go next, and also have your voice inform the conversations that we're bringing to the federal government right now. We know that they are listening deeply to what Canadians are saying on this issue. They're dealing with some incredible fiscal pressures. And the more that we can make the point that mental health and substance use health is important to our economic infrastructure, the more that we can demonstrate how this funding has really moved the needle and will continue to move the needle, the better. And we know that this is only one part of the system. This is one pocket of funding. And there's so much more that needs to be done in order to strengthen the system the way we know it needs to be strengthened. So we look forward to working with you in the next months and years to engage in that advocacy together. So we'll pause there and we'll invite folks to ask questions. I'll remind folks to submit your questions through the Q&A. And Marion, there's the first question here, and I'll read it out from Kate, and then I'll see if we've got another question in the queue as well. So the first question is, it's my understanding that Manitoba spends less than half of the percentage of GDP that other jurisdictions, and is this the recommended amount? What does CMHA recommend? Also, do you agree with current government separating mental health and addictions from larger healthcare systems? Do you see it having an effect or not?
So there's a lot of questions there. I don't want to answer for Manitoba because I'm in a role where I'm supporting the national organization. And I would say that more money and more investment is required in Manitoba, as with other provinces, around mental health, dedicated mental health funding support. The question about how government organizes its departments. And we see those things change when governments change, but also even in the tenure of a government, they sometimes change how they organize the portfolios. So in Manitoba, the mental health department within government is under the umbrella of the Department of Housing, Addiction, and Homelessness. And that is a huge department, as you can all imagine, with very important critical issues that they're managing and supports that they're focused on in terms of investments and strengthening the response to the needs of Manitobans. I think mental health is an important and critically important area that unfortunately can get lost when it's grouped in a large portfolio as it is in Manitoba. And so I think that there's opportunity to ensure that we're working with our government partners to have focus on those critical areas of mental health, substance use health, and addiction. And of course, there's many issues that are very intersectoral, as with housing and mental health and homelessness. But I think that when you've got such a huge portfolio, it's very, very challenging to keep all of those things top of mind. And so I think that's my response to that.
Awesome.
So the recommended amount and dedicate, I mean, we've certainly heard 12%, 15% of health budgets should be dedicated to mental health. That number has changed over the years, and there's lots of different thoughts about how we do that. We're not anywhere near that in Canada, in any province, frankly. So there's work to be done. And we've seen through the bilateral agreements really great investments made and great programs and services that have been bolstered as a result of those investments. And so we are really wanting to encourage all of us to express, the importance of that continued funding to ensure that this critical work continues in communities.
Thanks, Marion. And to build on that funding target, the research we conducted in 2024 in the state of mental health averaged about a 7% investment across provinces and territories in terms of their spend in mental health and substance use health and addiction care. And as you said, other G7 OECD countries are spending closer to that 12 to 15%. So we have a ways to go to meet our peers, and that advocacy continues. There's another question here, Marion, about accountability. So can you speak to what accountability mechanisms exist to track where funding has gone and what's happened and what we could be doing better?
The accountability question is an important one, because we want to all know, as Canadians, the people of Canada, who pay taxes, we want to know that those resources are making a difference. And so I think it's always really important to build in mechanisms for us to be able to demonstrate the impact those resources have made in the lives of Canadians and in communities across Canada. And sometimes the conversation around accountability really gets at the heart of autonomy and independence, and that can sometimes get in the way of what the really big opportunity is, which is about, is this making an impact? What we know is that with the bilateral agreements, there were more open-ended approaches taken to reporting on how those funds were being used. And different provinces and territories did different things in their reporting back to the federal government. And that allowed for those agreements to move forward and to not get caught up in tensions around being told what to report. And so I think the opportunity is to keep pushing for opportunities to strengthen how we demonstrate and measure impact. And I think that's really critically important. That is tied to accountability. We are hoping that this conversation around accountability doesn't get in the way of sustaining this funding and seeing it renewed.
Thanks, Marion. It's a bang on response. Kind of related to that, this is a question from Rachel Cook, how do we push government to get back to countrywide solutions? So taking kind of that national approach, swift yet meaningful action. There needs to be a framework for urgency. Young people especially need support in an era of chronic solution due to social media, for example. So kind of what would be your guidance in terms of how we create space for that national dialogue and a nationwide approach?
Well, I think conversations that we're having today are a part of that, right? Where we're bringing folks from across the country together to have a conversation. Certainly healthcare is under the jurisdiction of provinces, but the more we can create collaborative planning tables, the more we can really showcase and share practices and approaches and innovations that are making a huge difference, and to have those scaled across the country. I think those are really important opportunities. Certainly within CMHA, as an organization that has a presence across the country, we try and create as many opportunities as possible to have that kind of sharing back and forth. And we want to do more of that and to share those innovations and the difference they're making in communities and for the lives of Canadians, so that we're not reinventing the wheel, and we're actually showing and we're scaling up and we're, bringing programs that have made a difference and then tailoring them to our local context to be able to make sure that we can start to see those solutions have an impact in other jurisdictions. I think federal government has an opportunity also to invest in pan-Canadian initiatives, so that we are looking at what are the programs that need to be delivered nationwide and what programs really are better suited to local implementation. And I think we haven't necessarily figured out how best to shore up those programs that would really benefit from nationwide implementation. And there are many, including things that are focused on population mental health impacts, and how would we begin to have pan-Canadian approaches. I think that would be really, really critical as we keep moving forward, having those programs really get demonstrated in all of the local opportunities that we see across Canada.
Thanks, Marion. And building off that, a question from Michael Braithwaite at jack.org. And if this isn't already happening, can we work together? This is a strategy question on a national media campaign around this and with multiple partners. Do you think that's a good strategy, and could we do that?
I think it's the only way to do that, to do it together. And JAT.org, Kids Help Phone, we have investments that have been made to strengthen and grow the integrated youth service delivery model across the country. We have to be coming together to develop those kinds of strategies where we're leveraging our expertise that exists within Canada in all of these various organizations and connects to the grassroots. So it's really bringing the grassroots with the larger picture of a Canadian landscape that's quite vast geographically and with lots of diverse needs. So those kinds of partnerships are critical if we're going to make a difference.
Yeah. Thanks, Marion. With an eye on the time, we have so many questions, and we'll do our best to follow up with folks in writing for the more specific ones. But do you have any kind of final thoughts, Marion, as we go into the summer, budget's coming down, premiers continue to meet in PEI. Any recommendations, guidance, wise words from your side before we wrap up?
Well, I first want to acknowledge the amazing work that happens across this country. And this is hard work that people do. And I know within the community mental health sector, the innovation, the ingenuity that goes on to make a difference, and to often do so in the absence of having adequate funding. That's where, many of our community partners are so creative at diversifying their funding and not always counting on government funding. We know how huge of a difference this bilateral funding has made in communities across Canada. And I think the more we all understand the ways in which funding happens and the cycles of funding, the more we can have thoughtful conversations with our elected officials and to seize those opportunities. When you have an opportunity to connect with an MP, an MLA, and have a conversation around this important work, those conversations can make a big difference. And continue to share this information with those in your network and across your sector and in your communities so that, there is that public demand for good mental health and that we then exercise our rights in our democracy to express the importance of this work and the continuance of the bilateral funding.
Mm-hmm. Thank you so much, Marion, and thank you all for coming out today. Merci à vous. Ça a été une discussion extrêmement riche. There are some questions in terms of process and timing with regard to the federal budget. We know now's the critical time to be engaging with federal decision makers, whether it's the Minister of Finance himself, François Philippe Champagne, members of the Finance Committee, members of the Liberal Caucus, and all MPs who have a role to play in shaping the federal budget. We invite you to have those discussions now. The federal budget is likely to be tabled in October, November. So now's the time to really be talking as much as possible. And we know that this is one piece of a bigger puzzle. Many of you have talked about other legislative change opportunities, parity legislation, amendments to the Canada Health Act. These are all important pieces as well and won't be lost within the context of deeper discussion around how we build a mental health and substance use health system for all. So thank you so much for being with us today. We look forward to sharing a recording of this. We'll be in touch with you, and be sure to visit actformentalhealth.ca to become more involved. Thank you so much, everyone. Bon après-midi, bon reste de la journée pour tous et tous, et à la prochaine.